We have a human care approach that drives utilization and engagement, data intelligence that enables decision-making for our customers and even patients as well, and then the complementary services bit to meet most of primary care needs. The best of all, this costs less than a Starbucks coffee per employee. Hi everyone, it's a pleasure to be with all of you today. I'm Rafael López, co-founder of Diagnostikare, and we're a company based out of Mexico City that is truly changing and creating an impact in thousands of people. We all know access to care is a basic human right. Still, over 140 million people in Mexico and Latin America can't get the care they need. Let's have a look at some relevant facts in here. Very few people have insurance, they just can't afford to pay it. They spend quite a lot of their income in health for basic needs like medications or lab testing. There's still a lot we can do in terms of preventative care to save thousands of lives every year. But fortunately for us, online services are gaining traction when it comes to find care options out there. Let's give this reality a name. This is Juan, and as you can tell, Juan works for McDonald's. What is actually Juan's reality? Juan earns less than $15 a day. He has never had a health checkup in his life. Maybe he can't afford it, or he just believes he doesn't need it. He doesn't have a primary care physician he can go to, let alone have access to his medical records. He has never received nutritional coaching nor mental health support, although he would actually benefit a lot from this care given his stressed life. Whenever he needs to see a doctor, he ends up spending almost half a day of it, most likely without pay. And twice what he earns a day is gone when he gets sick. Juan, like many others, is part of the nearly 36 million employed people in Mexico that earn less than $400 a month. That's why the market is worth what it's worth, almost $65 billion. And it's an equal spend between both private and public sectors. What are we doing about it? The Diagnostikare solution is a pyramid approach to care, enabled by tech and data and backed by healthcare professionals. Let's look in more close. How does this look like in the hands of our patients and clients? We have a human care approach that drives utilization and engagement, data intelligence that enables decision-making for our customers and even patients as well, and then the complementary services bit to meet most of primary care needs. The best of all, this costs less than a Starbucks coffee per employee. What have we achieved in the last couple of years? A very interesting enrollment rate for employers, significant number of health interactions that keep feeding our platform, the appreciation and satisfaction of our patients, and the ability to actually solve their needs, plus the trust of several important clients, including McDonald's, where Juan works for. But we actually want to go further. That is why we have a solid qualified pipeline in the sectors that we know well and of significant economic value, translated into many more patients to serve from renowned clients who want to make a difference in the society in which they operate. My experience as an engineer and in the corporate world internationally, combined with my brother's experience as a doctor, plus the support of our great team, have allowed us to get here. Last but not least, among all these very recognitions, we're very proud to share that we're the first Mexican startup to be a finalist for the UCSF Health Awards in a couple of weeks at HLTH. Come join us to help us change lives of millions of people in Latin America. Thank you.
Awesome, Rafael. Appreciate that. Talk to us about the current regulatory landscape in Mexico around digital health reimbursement and just other regulatory frameworks that affect what you're doing.
It's very interesting. I mean, the country remains at very early stages when it comes to regulating these digital health solutions. Obviously, the pandemic had to make things move faster for the government to start assessing how they should actually regulate the digital health landscape in the country. We have built a very strong relationship even before the pandemic with the regulatory body, COFEPRIS, which is the equivalent to FDA in the country, to a point in which they have invited us personally to work hand in hand in the blueprint of what the new digital health law should look like for the upcoming year. So we're not just fully compliant now with what the regulatory landscape looks like, but also one step ahead of almost everyone else in this space. So there's still a lot of work to do, but this translates into a massive opportunity, actually.
Yeah. What's the competitive landscape like? Are there other large groups trying to do this wraparound digital health type of solution?
Yeah, typically large groups are, as we know, sometimes inefficient and they tend to move slower in the space. Quite a few other players from a startup perspective, smaller companies have been trying to consolidate their position. The market is massive. There's room almost for everyone that do things well, that are able to partner just like we've done with big names out there with great recognition, but most importantly, being able to demonstrate that our patients are being properly impacted by the solutions that we are providing. And obviously, this tends to larger companies or healthcare conglomerates to shift an eye into what companies like ourselves are doing.
Got it. You're starting in Mexico, but you mentioned moving into Latin America more broadly. What are some of the challenges and opportunities of that expansion over the next 3 to 5 years?
Yeah, that's super interesting. So we've built for the last couple of years a very solid and robust platform that's allowing us to actually scale and provide all the type of care services that we do at the moment, which is mainly general practitioning, nutritionists, mental health, and a couple of other well-being support. So from a scaling perspective into other markets, the only challenge that we are facing now is how do we ensure we are compliant in each of the countries in which we'll end up operating. And we're sorting out this challenge by just partnering with local clusters of physicians or healthcare professionals in the countries in which we'll be starting operation early next year. But then the platform, the care delivery model, the whole end-to-end approach is on us, and we're just basically outsourcing the last bit with qualified healthcare professionals that we've begun assessing already to meet our standards.
Got it. We got a question from the chat, and while I'm asking this, I'll let you know this. You've got time to put in one more question if you've got something burning that you want to ask Rafael. But the question for you is, have you done any pilots? And if yes, what have you found, and what have been the demographics of the patients who have participated?
It's a very interesting question. I would actually rephrase pilots for current patients and customers that we have now. As I said, we work with over 10 different employers, have over 40,000 enrolled patients in our platform, and are typically providing over 2,000 health interactions on a weekly basis. Demographics are quite interesting here. It's typical people aged between 19 to early 40s in the age range. The split between male and female is very similar. And if we look at it from, let's say, socioeconomical perspective, it's just the example of Juan from McDonald's that I told you about. These blue-collar people, hard workers that are earning not as much as we all would like, therefore seeing a massive impact and opportunity by getting care through us the way we've been doing it.
Gotcha. I have to ask, I love that your co-founder is your brother, and I just think about it exemplifies the role of trust in a startup relationship and the ability to move quickly because of that trust. I don't know, can you give me an example of an advantage that it has given you to have such a close relationship in your co-founder?
Yeah, this is an amazing point that you mentioned, Logan. You start off with already many checkboxes ticked when your co-founder is your brother. There are just so many things that come in natural that you don't actually have to either question or make sure that the framework is ready for you to start a company with someone. So that provides a lot of advantages when it comes to just focusing on solve the problem that we're aiming to solve. Each of us very focused on what we do best. No one can understand patients better and the healthcare system better than the way he does. And I'm complementing the other side of the business. But then you don't have to worry about any other typical issue that you might face with a co-founder that you haven't met for so many years, as it's the situation with us.